agencies, non-governmental organization, donor agency, corporate, civil society, international agency, and the media are urged to lend support for the effective implementation of our country's National Road Safety Action Plan. However, whilst emphasis is made to key responsible agencies and road safety partners, the development of a culture of road safety amongst all road users must be emphasized since personal responsibility in saving lives is a priority on our roadways. The Guyana National Road Safety Action Plan 27, we have created an action plan in 2017, 2019. It represents a holistic approach to road safety and was composed primarily in consistency with recommendations of Guyana National Road Safety Strategy. We do have a strategy also 2013-2020, the United Nations Global Plan for the Decade of Action for Road Safety 2011-2020, and the Brasilia Declaration, the second Global High-Level Conference on Road Safety. Time for results is now. So let's look at the country's commitment. It continues. The country also, the expiration of these plans that we just mentioned, they've been expired, and the country has declared will see the lead agency, the Ministry of Home Affairs, through the Road Safety Council, coordinating activities to continue to follow these and the new declaration. The action plan was formulated upon the five road safety pillars as outlined in the United Nations Global Plan for the Decade of Action for Road Safety 2011-2020. And it encapsulates an assortment of highly recommended preventative and remedial strategies which are geared to enhance road safety management, promote safer roads and mobility, ensure safer vehicles, safer use of roadways by all categories of road users, the establishment of an effective post-crash response team. I think the next slide, please. If you look at our slide, let us look at our situation before the Decade of Action 2020-2010, 2020-2011. Let's look at the decade of what was happening before the Decade of Action. That is our statistics. You can see our statistics up there. And those are the years that you can see, the years that 2020, 2000 and 2001, 2000, and all those years when our data was very, very high. We had in 2005, 182 persons dying on our roadways. And if you look at in 2007 in red, we had 207 deaths in our country at that time. We had 207 deaths in our country at that time. Because of interventions such as road safety interventions, such as public education awareness, such as the government of Guyana came on board. They called all the stakeholders and they told us that we have to do something. This is getting out of control. And we started to paint pedestrian crossings. The police started to do enforcement education, coupled with street lighting and all the other road safety furnitures. And if you look at our statistics again, you will see in 2008, we had 113 deaths. And because of interventions and the practices and the things that we learned from the Decade of Action, we were able to reduce that significantly the next year. And according to our research and statistics, it was proven that it was the lowest we had done in 39 years. So, and let us look at the Guyana situation during the Decade of Action. Because of the Decade of Action, if you look at Guyana's situation during the Decade of Action, let us look at it now, and you can see. Let us look at the situation during the Decade of Action. And if you look at 2011, because of the attention that was paid, we were paying attention, the Ministry of Home Affairs, they had given us increase of funding. We had some more funding. We were able to collaborate with our partners and do all the intervention, especially education, awareness, enforcement. When we talk about education, awareness, enforcement, we talk about civilians going on the roadways and we creating roadblocks, or what you would call police road stops, and where we would share flyers and education materials. And even sometimes we would target the motorcyclists, where we will actually be giving them motorcycle helmets. So because of these interventions, we were, if you look at the figures, you notice that in 2017 we had 100, in 2018 a 105, and we were able to pay attention. And every time we do not pay attention to what is going on the roadways, and we lack education and enforcement, and we do not pay much attention to what is going on in the roadways, then our statistics start to rise again. Because if you look at 2016, you look at 2014, there were no attention being paid. I think we had a transfer of government at that time. So that is why you can see our figures are looking like that. But whenever there's attention is being paid, and if you look at in 2020, if you look in 2020, we had 122 deaths. And because we always hear of the political will, whenever you hear about road safety, it's important that you must have the government of the day, the government that is the administration of the day. You must have them involved in road safety. And once you can have the attention of those persons, definitely you will see a reduction like you're seeing here in 2021. The Minister of Home Affairs, he personally came out. The Minister of Public Works, they personally came out and joined our road safety, public awareness, enforcement campaigns. And as you can see, that was the results. And in 2021, we had 99 deaths, the lowest in a very, very, very long time. We are hoping that in 2022, that we can keep the numbers below the 99. We're almost, last I checked, we were 87 persons died so far on our roadways. So we are hoping to keep it down below the 99. Next slide, please. So let us look at the National Road Safety Action Plan Performance Framework. Can you change the next slide, please? Now let's look at the framework. It's talking about the road safety pillars, the agencies that are responsible, and it's talking about the core responsibility of the agency. The first pillar, like we mentioned before, is the road safety management. And for road safety management, the agency that we've identified as one of the key and the core person that's responsible for that, for this particular area on this particular pillar, is the Ministry of Home Affairs, the Guyana Police Force, Traffic Department, Guyana National Road Safety Council, and the Ministry of Health. Let's see what is their core responsibilities. Their core responsibilities is for the Ministry of Home Affairs, it's policy, legislation, development, modification, research, data collection, and analysis. The Guyana Police Force is policy, legislation, enforcement, traffic surveillance, data collection, and education. The National Road Safety Council, same thing, data collection, formulation of road safety strategy, implementation of road safety campaigns and initiatives. The Ministry of Health, it's data collection, prevention, advocacy, and rehabilitation. When you talk about road safety is a non-communicable disease. It's a problem. You want to know why it is why we're talking road safety at the mental health conference. If you heard Dr. Hoven earlier, when a person is involved in an accident, there is trauma, there is so many things can happen afterwards. They might lose their father, and the children have to face those grief and all of the other aspect. The father might have been the breadwinner and things like that. So poverty, everything comes along with road crash and road deaths. Ministry of Health is one of our key partners for vital data. Ministry of Health is one of the ministry spends the most money on road crashes. You talk about rehabilitation, you talk about you talk about rehabilitation. When a person is injured, they might have to be in hospital for a whole month because they break their legs, something is happening. The Ministry of Health have to bear those costs. So that is why Ministry of Health is a very, very important, and that is how you can always remember that road safety is a serious health issue. If nothing is done with road deaths by the year 2030, it will be right now road deaths is surpassing AIDS, cancer, and diabetes. It's a worse situation than those three, who is very, very top on the agenda. Let's look at pillar 2, safer roads and mobility. The Ministry of Public Infrastructure is the agency that is responsible. The Ministry of Communities, I think that's the Ministry of Local Government now. So let us see what is their core responsibility. The core responsibility for the Ministry of Public Works is road infrastructure designs, road safety audits, maintenance and operation of stoplights and signs. One of the things that we should mention to you, the Ministry of Public Works is a very important, very, very important partner in road safety, because road signs and signals are the language of the road. That's the language of the road. If you want to know what is happening, where to go, where to turn, the signs and the signals will definitely tell you what to do and where to go and how to be safe. The language of the road, 50 miles per hour speed limit in this area. Why are we telling you that? Why is the language of the road telling you 50 miles an hour? It's telling you because you're going to be safe driving at 50 miles an hour in this particular area. So that is important. Let's look why we say the Ministry of Local Government. Local government they're responsible for urban planning and development. For instance, some of the areas like the Sapphire areas and the other areas like the areas that have a lot of population. Those are the urban areas that we are talking about, that the communities that Ministry of Local Government is responsible for. They're not the public roads, if we can make it as easy as possible, simple like that. The Ministry of Public Works is the one that's responsible for the public roads. Let's look at pillar 3, safer vehicles. Guyana Revenue Authority, the Licensing Revenue Office, the Bureau of Standards, those are the responsible agencies. Let us see what is their core responsibilities. Their core responsibilities are enforcement of safety standards for vehicles at all ports of entries, establishment of safety standards for vehicles. So that is what, if we doesn't have safe vehicles, then of course you might have a problem where your vehicle might not have a ABS, and you might have a crash, and there is no airbag to help to break whatever is injuries that's coming to you in that crash. So safer vehicles is very important. Can I have the next slide? Let's look at pillar 4, safer road users, the Ministry of Education, Georgetown Public Hospital Corporation, Ministry of Public Infrastructure, insurance agencies, international agencies like PAHO, WHO, IDB, Inter-American Development Bank, NGOs, Guyana Red Cross, Mothers in Black, Minibus Association and taxi associations, private sector, media, you and I, school children. Once you walk, ride, or drive, this pillar is definitely applying to you. Let's look at what is the Ministry of Education core responsibility. Curriculum development and implementation implementation on road safety. Let's see what's the Georgetown Hospital's role. They have to do with post-crash response and post-crash services. Ministry of Public Infrastructure, their role is road infrastructure, designs, road safety audits, maintenance, operation of stoplights and signs, and also the insurance agencies are responsible for post-crash support. They can lend to these things. in a way like, for instance, let us be talking about preventative measures. The insurance companies, if they have a database of persons who make kill people by driving under the influence, or kill people by inattentiveness, or however they come up with whatever the insurance company have the database, we can tap into that database and know who's the delinquent drivers and who we can actually do retraining or training with.